Good evening to everyone and welcome to today's wonderful discussion. NEET PG 2021. We still have 40 days time, a very comfortable pitch to play the game. Every day, evening 6 o'clock, you have Dr. Murali Bharadwaz for about 90 minutes. We will do a revision of 100 MCQs. And these 100 MCQs are being created like a mock test and made available in the Incus learning app. So every day when you wake up, just open the Incus learning app, go to the mock test, take the mock test. Hardly it won't take even 45 minutes to 1 hour to finish 100 questions. Then in the history, you can see the result, how you are performing in comparison to others and to yourself. Then you decide, okay, these are the 20 to 30 topics I'm doing really bad. So evening 6 o'clock, you attend this discussion, absolutely free. And after the discussion is over, you have to be sure that those 20, 30 topics that you identify, where you are lagging behind every day, and just go back once more to the Incus learning app and do the revision of those topics that you picked up at the end of this discussion. So that way, every day, daily mock test, every year, last 2 months, November, December, 60 days actually. 60 daily full-scale grand tests we conduct along with the discussion in the evening. So let us do that and also inform your classmates that to not forget to log in. You have a classmate, roommate, benchmate, tablemate to study along with you every day. That is Dr. Murali Bharadwaz will hold your hand and take you to become the topper in the NEET PG exam. So let's make the great beginning, Doctor. Thank you very much for almost 14 online classmates. I'll run very fast because this is basically a quick review of the mock test. That is, if you answered the test before the discussion, it looks normal speed. But if you have not answered the mock test, this looks little fast. But there is no other way. We need to quickly review the questions. Now, cardiac muscle. In cardiac muscle, summation cannot occur. It contains myoglobin, slow myosin ATPase activity, that is all true. But fundamentally, cardiac muscle is a slow muscle. That is, the twitch duration is longer compared to that of, if you compare the cardiac muscle with that of the skeletal muscle is a fast muscle. So if you take the average twitch duration of in the case of the cardiac muscle, it is around 800 milliseconds when the heart rate is 75 beats per minute is what you need to remember. So cardiac muscle is slow. That's a point you need to know. Now, how do nociceptors signal? So nociceptors basically signal through the, is it A alpha, A beta, A gamma, A epsilon? So you have to be very sure on the nerve fiber classification. When you get EPSPs and IPSPs, good to see almost 17 online classmates. Very good, doctor. Please inform your friends. So now what is required is Every day you need to charge yourself. And any didactic teaching, video lectures, they're all boring. You get challenged yourself by answering 100 MCQ grand test in the morning on the Incus app, and evening you participate this free YouTube discussion. Bus for the next 40 days. अगर सीट नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं. These are the most expected MCQs in the tomorrow's NEET PG exam, doctor. So opening of the sodium channels, closure of the potassium channels, opening of the calcium channels, they are all EPSPs. Whereas opening of the chloride channels will lead to IPSPs is what you need to remember. Tetanus plasmin. How does it act? How does it lead to tetanus? It inhibits the release of the glycine. That is how the tetanus toxin lead to development of spastic paralysis is what you need to remember. So basically, glycine is an inhibitory transmitter. If you inhibit the release of an inhibitory transmitter, what will you have? Continuous, unopposed stimulation. And that leads to the development of the tetanus is what you need to remember. Now, the locomotion generation. Can online students can punch, whether the voice is loud and clear for all of you, without any interruption? So, yeah, I would like to know whether online students is a broadcast good? Yeah. Okay. I hope there is no fluctuation. Let me check. Can you please punch whether the broadcast is smooth or are there any interruptions? Yeah. Yeah. I need a feedback. Please type whether broadcast is fast or not. Yeah. Can the online students can give a feedback whether the broadcast is fast or not? One minute, doctor. Let me check. Let me check the internet speed. Okay, Majumdar is saying it is fast and good enough. Nothing to worry. Okay. All right. Is everybody able to get the good broadcast? Okay. Okay. Locomotion generators in the spinal cord, how are they turned on? Is a important question. It is the midbrain where the locomotion generators are typically located. So if you look at the infrastructure of the locomotion, if you look at the infrastructure of the locomotion, in the cerebral cortex, you have the centers for fine motor skills like speech, hand finger control, etc. Then you have the basal ganglia. Then there is a cerebellum which controls. Then in the brainstem, there is a mesencephalic locomotor center, which is located in the midbrain. And once more, there are protective reflexes happening in the spinal cord. So that is how the motor activity is overall controlled and regulated. Now I like to ask you a question. What is this a typical appearance of? Is it squamous or basal cell carcinoma? Who is going to give me the answer? Please punch your answers, doctor. What you are seeing, I want to ask some quick quiz questions to know whether you are able to follow it keenly or not. Now tell me, please punch your answers. I'm waiting for your answers. What you are seeing here, is it basal cell carcinoma or squamous cell carcinoma? Come on, punch your answer. Basal cell carcinoma or squamous cell carcinoma? What are you seeing here? Yes. So it is the classical lesion of a basal cell carcinoma, rodent ulcer is what you have to ultimately remember. Now, doctor, NADPH, let's talk about it. NADPH. 1 minute, doctor. I'll just get, my internet is fluctuating, so let me get a proper internet. Just give me a few minutes, doctor. I'll just set the internet properly and then restart the session. Please be online. Yes, welcome back to the session, Doctor. We had a little issue with the internet today, so I hope it's all well restored. Now, yes. Regarding the functions of the NADPH, so there are two things, NADH and NADPH. So you should remember that all synthetic reactions, glycogen synthesis is synthetic reaction, glycolysis is catabolic reaction. All anabolic synthetic reactions, it is the NADPH, catabolic and lytic reactions, it is the NADH. That's what you need to remember. So NADPH is used to reduce the glutathione, and it is the anabolic, not catabolic processes where NADPH will be used. It is used to regenerate the substances that transport the amino acids across the membranes, and it is also used to prevent the oxidative damage to the cells by reducing the hydrogen peroxide, is what you have to emphatically remember. Now, about the bile salts, bile acids, what is the favorite question of the examiner? So you should remember that the glycocholic acid has a higher pK than taurocholic acid, and taurine is derived from cysteine, and the taurocholic acid, it can ionize very readily in the gut. So there are a few things about the bile salts. The bile salts have a pK of about 4. And the pK is lower, that is conjugated versus unconjugated bile acids. If you take the conjugated bile salts have a pK which is lower than the unconjugated bile salts. So that is the reason the conjugated bile salts are ionized at pH 6 in the gut lumen, and that is the reason they serve as a very good detergent, is what you need to remember. Now coming to the taurine, the sulfite group of the taurine, it has a pK of about 2, and it ionizes very readily in the gut, and one of the best detergent among the bile salts, is what you need to ultimately remember. Then once more, a lot of times the questions are asked on all these power equations, which you have to be very good with. So one of the common questions asked is, how much energy is generated whenever there is any fatty acid oxidation, whenever a glucose molecule is being oxidized aerobically, anaerobically, all these things you have to be 100% sure. So when 1 mole of palmitoyl-CoA has got a 16 carbon moiety. When 1 mole of palmitoyl-CoA is oxidized, 7 moles of FADH2, 7 moles of NADH, 8 moles of acetyl-CoA are formed. This you should not forget. And each of these 7 moles of FADH2 generates about 1.5 moles of ATP and a total of 10.5 moles of ATP. And each of the 7 moles of NADH generates about 2.5 moles of ATP and a total of 17.5 moles of ATP. And each of these 8 moles of acetyl-CoA can enter citric acid cycle, and they produce 10 moles of ATP. So totally 8 into 10 means 80 moles of ATP. So that is the reason this 80 moles of ATP plus this 17.5 moles of ATP plus 10.5 moles of ATP together कितना हो गया? 17.5 plus 10.5 is 28. 28 plus 80 is 108. So totally 108 moles are produced. But if you look at the first step of the fatty acid beta oxidation, in the first step, 2 ATPs are being broken down in order to activation to happen. So the net result is 108 minus 2 is equal to 106 ATPs is what you should remember. Now, what is the coenzyme of delta aminolevulanic acid synthase? One of our favorite questions. Pyridoxal phosphate. So you should know in the first step, succinyl-CoA condenses with the glycine to form the aminolevulinate, and it is the allosynthetase. So this delta aminolevulanic acid synthase uses the pyridoxal phosphate as a cofactor, and the glycine is decarboxylated in this step is what you need to remember. I'm telling you, doctor, biochemistry, totally there are 18 biochemical cycles. Urea cycle, amino acid metabolism, galactose, glucose, glycogen, fatty acid beta oxidation, fatty acid synthesis. So once you are good with, automatically out of 10 marks they are going to ask, you are going to make 7 to 8 marks comfortably khatam karega. So now, which enzyme is deficient in most common type of porphyria? First of all, what is most common type of porphyria, doctor? Porphyria cutanea tarda is what you need to remember. So, it is the uroporphyrinogen decarboxylase, which is the enzyme which is deficient. It is an autosomal dominant disorder. Most common porphyria, and it leads to photosensitivity with the vesicles and bullae. Is what you need to remember. Porphyria cutanea tarda. It's something you are not going to forget. So uroporphyrinogen decarboxylase will convert uroporphyrinogen 3 into coproporphyrinogen 2 is what you should remember. Now I like to ask you a question. There is a dislocation. What you are seeing here? What you are seeing in this lens of the chain? A small quiz question for you to answer. Always, only me talking is no good. You talking, me talking, two talking, both talking is good. Come on, please punch, doctor. Then only this is called interactive session. Otherwise, it is only a one way. Yes, doctor. What is your comment? Is it Wilson, galactosemia, oil drop cataract, dislocation? What is that you like to consider? Punch your answers, doctor. So you should know there is a bilateral spontaneous anterior dislocation of the crystalline lens in this infant. That is what you are seeing in this. Now, doctor, which organism grows optimally at 42 but not at 37? There is a special thing about Helicobacter pylori is what you need to remember. Varun, very good. Varun is one of the serious NEET PG aspirant. I really appreciate Varun is every day participating in our mock tests, which are there on the Incus app. I hope he is enjoying playing with those quiz tournaments on the Incus app. So after every question, you will get the leaderboard. That is the beauty part of the Incus. If about 50 students are there, 50 students, how they answered that particular question. How many answered A, B, C, D, everything. You will get analysis just like that. So that is the reason I advise all of you to download the Incus app and play the tournaments. So, Campylobacter species, even Helicobacter is similar to that. Campylobacter grows on the chocolate agar at 37 degrees in a micro-aerophilic environment. So that is the reason you grow it in Campi pack or aerophilic jar. Similarly, H. pylori, it grows more slowly than Campylobacter jejuni, requiring 5 to 7 days of incubation. So both H. pylori and Campylobacter. So Campylobacter grows optimally at 42 degrees, not 37. Even H. pylori also, only at 42, but not 37. That's what you should remember. So what is the major determinant of the virulence in H. influenza? It is the capsule. It's a capsulated organism. So the major determinant is capsule. Ganglioside receptors on the host cell, which toxin will bind and increase the cyclic AMP. Is the Is it interrupted, doctor? Yeah. Today, a lot of internet interruptions. Sorry, really, about it. But sometimes life is not in our control. Yeah. Hope it is all right now. Is it fine for everybody? Okay. So continuing our discussion with regard to the leprosy. So leprosy primarily affects the skin, peripheral nerves, mucous membranes. Tuberculoid leprosy has fewer lesions. Lepramin test is negative. Tons and tons and tons of acid-fast mycobacteria is what you need to appreciate. With regard to the Mycoplasma pneumoniae, it is called walking pneumonia. It can be treated with erythromycin. 50% of the cases show the cold agglutinin, and cephalosporins or penicillins, which basically act on the cell wall synthesis. They are not effective on mycoplasma because mycoplasma don't have a cell wall, as all of you know very well. Coming to the Bacteroides. Bacteroides fragilis is the part of the normal intestinal flora. Bacteroides fragilis cause the wound infections. It is an anaerobic gram-negative rod is what you need to remember. And one truth about Bacteroides, uniformly, all the gram-negative rods are resistant fundamentally to aminoglycosides and even to penicillin is what you have to emphatically remember. Now, I want to give you one quick picture test. So you are seeing the lesions in both the calvarium and also gingival, and here you can see the lesions. So what is your spot diagnosis of this case? Do you like to call this meningioma or teniasolium or cystosoma or stooge vulva? What is your answer, doctor? Punch your answer, and I'm waiting for your answer. Yes. Please punch your answer. So what is this most likely to be a lesion? I'm waiting for your answer. Yes. Very good. Varun, absolutely right. It is a Stooge-Weber angiomatosis where there is a gingival enlargement along with tram line calcification, you know. This is basically called the tram line calcification is what you're able to see. In the calvarium is what you need to remember. Good. Morphine lead to emesis. It depresses the cough reflex. It leads to euphoria, but it leads to meiosis is what you need to remember, not mydriasis. Now, Lennox-Gastaut syndrome. So, invariably in the tomorrow's NEET PG, take it as my word. One MCQ is going to come on the topic of epilepsy. General medicine में epilepsy, pediatrics में epilepsy, pharmacology में epilepsy. Without epilepsy, examiner रुकेगा नहीं. That is very important. So Lennox-Gastaut syndrome. So topiramate, lamotrigine, Devalprex, they're all effective in the case of the Lennox-Gastaut syndrome. If you have done this question wrong, immediately you need to go to, you know what I'm going to say, Incus app. 2000 HD videos are there, subject-wise, divided. In that, go to the pharmacology. In that, anti-epileptic drugs बोल के एक 20-minute video रहता. Please do the quick revision of that video, doctor. These are all inhibitors of P450, but not glucocorticoids. So inducers are anticonvulsants, antibiotics like rifampin, chronic alcohol glucocorticoids. Whereas P450 inhibitors are all anti-ulcer medications like omeprazole, similarly chloramphenicol, macrolides, ritonavir, ketoconazole, acute alcohol, anything can be an inhibitor. Chronic alcohol is an inducer of the P450. That is the interesting point you need to remember. The inhibitor of the metabolism of the theophylline, it is the macrolide. So you should know inducers, inhibitors of P450. आज का नहीं जमाने से पूछा गया क्वेश्चन है. Inducers and inhibitors of P450 is the favorite topic of the examiner. Phase 1 biotransformation. It includes oxidation, reduction, hydrolysis, but not conjugation. Which drug is known to block the potassium channels in the heart and also blocks the calcium channels in the AV node? Which drug it is? It is the amidaron. What is this, doctor? One of the important side effects of amidaron? Hyperpigmentation. It also leads to corneal deposits. There are at least 8 side effects of the amidaron. आपके टिप्स में रहना, पॉकेट के अंदर रहना, ठीक है? Now, any blocker of potassium channel will prolong the action potential duration and ERP, effective refractory period, and that lead to development of torsades de pointes and ventricular arrhythmias, is what you have to remember. So, amidaron is sodium channel blocker, beta blocker, potassium channel blocker, calcium channel blocker. So many blocker is the amidaron is what you need to remember. Cons syndrome होता है, adrenal adenoma is what you need to remember. In adrenal adenoma, there is excessive mineralocorticoid. What does excessive mineralocorticoid will do? It will retain the sodium. It will lose the potassium into urine. So you find hypokalemia, not hyper. That's the point you need to appreciate. So hypokalemia, hypertension, metabolic alkalosis, glucose intolerance, and weakness. This is the combination of the clinical features you need to remember about the Kahn syndrome. Mast cells के ऊपर क्या है? Immunoglobulin E. Proliferation of the T lymphocytes, B lymphocytes. Typically, where do you see? Interleukin 2. I made one mnemonic for interleukins and made a video on the YouTube itself in our channel. Please go through that and try to revise. Interleukins, definitely one question will come. So interleukin 2 acts on the T cells to induce their progression through the cell cycle. They also act as a growth factor for the B cells. is what you need to remember. A 13-year-old child with blue sclera, mildly short stature, no deformity, with a history of significant fractured bones is type 1 osteogenesis imperfecta. Mildly short stature, no deformity. That is the important thing. So type 1 is mild, type 2 is very severe and usually lethal. Type 3 is progressive and deforming, type 4 is deforming, but normal sclera. So that's how the osteogenesis imperfecta is being classified into. Which pathological cells in a stained blood film have an appearance similar to normal WBCs? Typically in chronic lymphocytic leukemia, you get what are called smudge cells. That is when you are preparing the smear, when you rub the slide, the glass slide, then they become broken. That's called smudge cell. So smudge cells which have a normal appearance that of the other B cells, lymphocytes, is a characteristic feature of CLL is what you need to remember. Left-sided infective endocrinitis, Staph aureus, Streptococcus viridans, Enterococcus, they are all implicated. Cuts on genitalia, unless proven otherwise, always are homicidal. So ears, nose and genitalia, invariably homicidal. Antebortum versus postmortem, you should 100% sure about the differences, doctor. A painful table is coming. इस table अलमीरा को आपके mind में लगाओ. Antebortum wound is typically the hemorrhage is in the antebortum wound. It is arterial. Whereas postmortem wound is venous. In antebortum wound, the blood is clotted and the clot is laminated and firmly adherent to the endothelial lining. It is firm, rubbery, variegated. Postmortem wound, the blood is usually not clotted, and if clot is there, it is not laminated, it is weakly adherent to the endothelial lining. It is soft, friable chicken fat or currant jelly in appearance is what you need to remember. Yes, doctor. So, second point, antebortum wound, the hemorrhage is copious. It is deep staining on the edge, which can't be washed away. Whereas the postmortem wound, staining is superficial and can be washed away. Similarly, wound edges are gaping, everted and swollen in antebortum, but whereas opposed and not swollen in postmortem. Vital reaction, very important is vital reaction. Vital reaction, the signs of inflammation, infection, healing, granulation tissue, they're all the features of the antemortem hemorrhage, but not the postmortem is what you should remember. So doctor, ये टेबल जो है ना, इसको आपके मन में, दिल में रखे. कल के एग्जाम में जरूर एक क्वेश्चन आएगा और मुरली भरद्वाज याद आएगा एग्जाम हॉल में. Now doctor, bruise, even with a slight trauma, is most common in which area? Typically on the face. On the face. Nausea, vomiting, mild abdominal pain, garlicky odor, transfers white lines on the nails, arsenic poisoning. Then what is the type of pigmentation of the skin in arsenic poisoning called? Raindrop pigmentation, arsenic poisoning. Then what are they called? Those lines, Aldrich-Mees lines are the ones which you typically see in arsenic poisoning. When one object meets another object, some amount of energy is transferred. That's called Locard principle. Now, what are these lines? 18-year non-smoking man comes to emergency with a diffuse colicky abdominal pain. What you are seeing here, no doctor? They're all called Burton's lines. Burton's lines, in case of the lead poisoning, is what you need to appreciate. Now, in a population of 5,000, crude birth rate is 25 per thousand. So, how many thousands are there in 5,005? 5 into 25, 125. Kitne BCG doses dete? 1. So, that is the reason totally how many BCG vaccines should be required? 125 BCG vaccines are required. What is the correct way of administration of oral pills for postcoital contraception? Immediately 2 ले लो और 12 घंटे के बाद 2 ले लो, खत्म prescription. So it is this postcoital method. Everything, anything about contraception, without that there is no question paper. 2 immediately, 2 after 12 hours. With regard to the vaccines, reconstituted measles vaccine, it should be given within 1 hour of reconstitution. Diluent for measles vaccine should be stored in the lower shelf of the refrigerator. And the diluent for BCG vaccine hota hai normal saline. So once more, doctor, which vaccines in the deep freezer? Which vaccine should not be in deep freezer? All those things we have discussed, debated, and made available in the Incus learning app. So what is the advantage of the intrauterine contraceptive devices? Simple to insert, reversible, no metabolic side effects. They're all the things about the IU series. On the average, healthy babies, they double their weight by 6 months, quadruple their weight by 2 years, treble their birth weight by 1 year. That is true, not 2 years. So the protein quality indicator used by the ICMR in all the recommendations, it is the NPU, net protein utilization, is what you have to remember. Net protein utilization. Amino acid score as an indicator of the quality of the protein. What is the meaning of it? It is a measure of the concentration of each amino acid in the test protein expressed as a percentage of that amino acid in the reference protein, which is basically called the amino acid score. Number of milligrams of one given amino acid per gram of protein by number of milligrams of the same amino acid per gram of the protein into 100 will give you amino acid score. The net protein utilization means nitrogen retained by the body divided by nitrogen intake into 100 will give you the NPU. So 1 gram of the protein is assumed to be equivalent to 6.25 grams of nitrogen. And most of the Indian diets, what is the range of the NPU, doctor? It is between 50 to 80. 50 to 80 is what you need to remember. So what is the dietary recommendation of ICMR? 1 gram of protein per kilogram of body weight for an adult male and female, assuming NPU of 65. Mala NPU, 1 gram per protein per kg of body weight is the required intake of the protein recommended. Pellagra is very common in Andhra Pradesh and Telangana. Over a period of decades, if the frequency is measured, that's called secular trend. Between primary and secondary case, it is called serial interval. Multi-purpose health workers were introduced by Kartar Singh Committee of 1973. Now, what is this appearance, doctor? This is called steeple sign. One small pictorial for all of you. The commonest cause of the death, pediatric population, when there is a decay, cerebral edema. You should not forget this. Especially pediatric, of course, decay is very common in children only because type 1 diabetes, first time when it is detected, it is commonly found with decay. Cerebral edema is the presentation. Reactive hypoglycemia. Leucine sensitivity, alimentary hyperinsulinemia, galactosemia. In all this, you find reactive hypoglycemia is what you need to remember. Allopurinol, 6-mercaptopurine, azathioprine. They both are inactivated by xanthine oxidase. So there is a threefold increase in amoxicillin and ampicillin interacting with allopurinol and skin rash occurs. Alcohol and allopurinol, they don't have any interaction is what you should remember. Microalbuminuria has a very close relation with retinopathy of diabetes. Interferon agar liye to it looks like a viral fever. All those chills, flu-like illness, they're all known. Even hypothyroidism, hyperthyroidism, flu-like illness, anything can be the side effect of the interferon. There is no exoerythrocytic cycle for Plasmodium malariae and falciparum. Massive splenomegaly we see in visceral leishmaniasis, CML, and hyperreactive malarial splenomegaly. It's also called tropical splenomegaly. Now, in typhoid, what you get is a palpable spleen, not a massive splenomegaly. Now, which all these beta-lactams are okay with pregnancy, amoxicillin, methicillin, cephalosporin, but imipenem, silastine, they are contraindicated in pregnancy. Superior vena cava obstruction can be a feature of lymphoma, pulmonary fibrosis, small cell carcinoma, mediastinal fibrosis, not pulmonary fibrosis. Mediastinal fibrosis, small cell carcinoma, commonly lymphoma, can lead to SVC obstruction is what you should remember. In HOCM, you should avoid beta blocker. Why? If you give beta blocker, it slows the heart rate. At a slower heart rate, the diastolic filling time increases. There is more time for the heart to fill. So when the heart fills more, the chamber size will be increased. If the chamber size is increased, then the touching of the mitral valve with the hypertrophied interventricular septum will be lesser. So the outflow obstruction will be lesser. Barabar? Once more I am repeating for you. Beta blocker slows the heart rate. Slowed heart rate will give more time for the ventricle to fill. The more the ventricular filling, the left ventricular filling, then the hypertrophied interventricular septum and the mitral leaflet won't touch each other, and that will let the LV outflow obstruction decrease. So that is the reason beta blockers are good. Tachycardia is bad, digitalis is bad, diuretics bad, nitrates bad. But beta blockers are good because they decrease the heart rate, increase the ventricular filling time, increase the amount of blood filling the ventricle, increase the ventricular diameter, and decrease the touching of the mitral leaflet with the interventricular septum, and that diminishes the left ventricular outflow obstruction. So beta blockers are used for treatment. Digoxin na, digitalis nahi, diuretics nahi dena, nitrates nahi dena. That is all important because nitrates, diuretics, and all these things, what do they do? They decrease the preload. If the preload to the heart is decreased, filling of the heart is decreased. So ventricle becomes a smaller ventricle, and that will increase the touching between the hypertrophied interventricular septum and the mitral leaflet. Where if they both touch with a smaller size of ventricle, then what will happen? The ventricular outflow. See, this hypertrophied septum and this anteromitral leaflet, if they come closer and touch each other, then this outflow, left ventricular outflow into the aorta, that get affected. So that's what you need to remember. Now I want to quickly present you one classical ECG, which is going to be asked in tomorrow's exam. 62-year-old man with chronic renal failure. This is the ECG finding. So what is this called? Sine wave pattern, which is typically seen when there's a severe hyperkalemia. After 24 hours of treatment, once more the normal sinus rhythm retains. So that is what you need to remember. So wide QRS complexes and sine wave pattern. Whenever there is a significant hyperkalemia, you should remember. Now, doctor, which drugs cause pericarditis? Doxorubicin, hydralazine, procainamide, they're all implicated to lead to pericarditis. In myocardial infarction, beyond 1 week, which marker will continue? Troponin T will prolong beyond 1 week. It will persist for 7 to 10 days. That is the reason if you want to detect recurrent infarction, it is difficult with troponin T. Secondary prevention of MI. ACE inhibitors, antiplatelets, aspirin, they're all recommended, not calcium antagonist. In fact, calcium antagonist can precipitate CHF a lot of times after MI when the patients go home. If they come back with CHF, you should always remember to check their OPD, their drug list, whether there is any calcium channel blocker. Common predisposing factor for the CHF in a post-MI period when the patient comes back to your OP. When there is an isolated systolic hypertension, there's a widened pulse pressure, there's a rise systolic pressure with a normal diastolic pressure. It is commonly seen in the elderly over 50 years. And it needs to be treated with antihypertensives. That's the point I want you to remember. Severity of mitral stenosis. How do you assess it, doctor? So you should know it is the length of the murmur and S2 OS gap. Opening snap and S2. ये दोनों के बीच में gap कितना है? Shorter the gap, greater is the severity. Similarly, length of the murmur also diastolic, mid-diastolic murmur of the MS, the length of the murmur also is a determinant. Now coming to the TB in HIV, cavitation is less common. whenever HIV plus TB होता है. Adverse drug reactions with the TB drugs, they are more common whenever HIV and TB दोनों मिलके होता है. Hepatitis is a common side effect of pyrazinamide, rifampicin, isoniazid, but not ethambutol, which is relatively safer from the liver. So once more, I want to tell all of you, doctor, this session looks little faster. Arey kya hai? Sir is running like a Shatabdi Express. वैसा feeling आता है. But let me tell you, please visit, download Incus learning app. आपके footer में 4 icons रहता है. एक है home का icon. Second is you have a video camera like icon. Another is camera like icon and dashboard. So basically, so you find 4 icons. एक कोर्सेस वाला आइकन अगर आप दबाए तो आपको पूरा एग्जाम्स दिखाएगा. नीट पीजी, नीट यूजी, आईआईटी, गेट और सब. उसमें नीट पीजी देख लो. नीट पीजी क्लिक करे तो आपको मिलेगा क्विज कोर्सेस, वीडियो कोर्सेस. क्विज कोर्सेस में आपको रहेगा 40 ग्रैंड टेस्ट का, 40 ग्रैंड टेस्ट इन 40 डेज, एवरी डे 100 MCQ वाला ग्रैंड टेस्ट. Once you click on that, day wise you will find grand test. So today date क्या है? 7th March. So 7th March वाला solve करो and शाम को discussion attend करो. Tomorrow 8th March 100 question वाला solve करो और evening discussion में participate करो. And whatever that every discussion end of it, you pick up 10 to 15 topics and try to do the revision of them in the video library. You also have a 2000 HD videos available on the Incus learning app, right, doctor? So now, idiopathic interstitial lung disease, good prognosis on stopping the smoking. Which one? It is the respiratory bronchiolitis. It is also called ILD. It has a good prognosis on stopping the smoking. Whereas cryptogenic fibrosing alveolitis and acute interstitial pneumonia, they have a poor prognosis, which is the contraindication for thrombolytic therapy. Any active internal bleeding, suspected acute dissection, recent head trauma, surgery within 2 weeks, they're all considered to be. So you have absolute and relative contraindications, doctor. So similarly, hemorrhagic retinopathy, pregnancy, systolic BP more than 180 or history of CVA. They're all the other contraindications you need to remember. This is the favorite question of the examiner, doctor. Reis syndrome. In case of children, whenever there's a viral fever, if they happen to take aspirin, they end up in hepatic encephalopathy acutely, which is called Reis syndrome. So there is encephalopathy, microvesicular steatosis and seen in pediatric population, but there is no jaundice, no jaundice, no jaundice, no jaundice in Reis syndrome. Favorite question of the examiner. So if you are given a X-ray tomorrow, a quick spotter, there's a lot of air, you know, this is the liver, this is the diaphragm, between the two, there's a lot of air. So this is an example of pneumoperitoneum, which occurs whenever there is any perforation, is what you should remember. Now, doctor, if you take breast milk versus the bottle-fed milk. Breast milk is relatively a poor source of vitamin K. Hemorrhagic disease of the newborn is more frequent in the breast-fed than formula-fed. And the factor 2, 7, 9, 10, which are vitamin K dependent factors, there's a moderate decrease normally in all newborns by 48 to 72 hours. So that are the truths about the hemorrhagic disease of the newborn. Now, doctor, by what time does the heartbeat begin? 4 to 5 weeks is what you need to remember. The blood smear in a 2-year-old is showing target cells. Always target cells, these are called target cells, target. Typically, you should always evaluate for the presence of any thalassemia. So, you should always do a HB electrophoresis. Fifth disease, slapped cheek appearance, parvovirus B19, arthritis as a complication. But what is the incubation period? 4 to 14 days for the erythema infectiosum is what you should remember. Convulsions, cataract, and mental retardation. They're all the features seen in galactosemia. Most common cause of a severe obstructive uropathy in an infant and child is posterior urethral valves. Now, in which disorder penicillin is not used for antimicrobial prophylaxis? Diphtheria, rheumatic fever, asplenia, in all that you give penicillin, but not meningococcal. So where do you use penicillins as prophylaxis? You need to know the list. And meningococcal में क्या देते? Rifampicin. Rifampicin is the chemoprophylaxis of close contacts is what you need to remember. In tetralogy of Fallot, there is a pulmonic stenosis, so right ventricular hypertrophy. PDA with pulmonary hypertension, there is a right ventricular hypertrophy. Ostium secundum type of ASD. What will happen in ASD? Left atrial blood will shunt into right atrium and that will enter into the right ventricle and leading to increased flow in right ventricle, leading to right ventricular hypertrophy. But if there is tricuspid atresia, the very blood flow from right atrium to right ventricle is diminished. So if there is no blood coming at all, why will it hypertrophy? It won't. So there is no right ventricular hypertrophy in tricuspid atresia. There is never left ventricular hypertrophy in isolated mitral stenosis. These are the two funda you need to remember. If there is left ventricular chamber enlargement or hypertrophy, then it is never a pure MS. If there is right ventricular hypertrophy, it is never a tricuspid atresia. So they are the classical dictum. A 2-year-old healthy child develops breathlessness while playing. Suddenly means foreign body aspiration, simple. Retarded intrauterine fetal growth, small for date babies. Now, what is this classical appearance, doctor? It is the classical appearance of a dilated esophagus with a rat tail-like appearance of achalasia. Achalasia is what you should remember. Now, train of 4 fading, where do you see? Myasthenia gravis, non-depolarizing blockade, phase 2 block in all that. You see, train of 4 fade is what you need to remember. So it is seen in phase 2 block and myasthenia gravis, non-depolarizing blockade. Not in Eaton-Lambert or phase 1 or aminoglycoside overdose or magnesium treatment. In all this also there is a muscle weakness, but you don't find a train of 4 fading is what you have to remember. Now which agent decreases the cerebral metabolic rate? Propofol, etomidate, thiopentol, all of them are known to decrease the cerebral metabolic rate. Opioids do not decrease. I'm so happy to see 16 online classmates. Please inform all your friends every day 6 p.m. to 7:30 p.m. 100 MCQs daily mock test discussion hota hai, and these mock tests are all available in the Incus learning app under the quiz courses. You download the app today only, and day wise you have the mock test available. You solve the mock test before you come to this discussion. It will be much more meaningful. Then about propofol. Isoflurane increases CBF, propofol decrease the cerebral metabolic rate, isoflurane decrease the cerebral metabolic rate. So propofol and isoflurane, both of them decrease the cerebral metabolic rate, whereas propofol causes cerebral vasoconstriction and a decrease in CBF is what you need to remember. Which muscle relaxant is metabolized by the cholinesterase? Mivacurium. So succinylcholine, mivacurium, they both are choline esters. Highest amount of allergic reaction to bromide. Pancuronium typically has the highest amount of allergic reaction due to the bromide is what you need to remember. So what are all the various agents that lead to allergic reactions? Succinylcholine is the worst offender. After that, metocurine for the iodine. Pancuronium for bromide cause most allergic reactions. Similarly, whenever you are giving muscle relaxants, they can release histamine. They can release histamine, and that can lead to hypotension, is what you need to remember. Now, what is your spot diagnosis of this, doctor? ये तो कल के नीट पीजी में आने वाला क्वेश्चन है. There is involuntary right arm movement. That means ethitosis. Ethitosis is also there. So typically Kaiser-Fischker ring is what you are able to see. And what do you do? Genetic testing. You have to look for the mutation of the ATP7B is what you need to ultimately remember. So Dr. Shanti, Shanti. So that brings us to the end of today's wonderful evening. Every day, 6 p.m. to 7:30, Dr. Murali Bharadwaz with you until April 18th. Right? So take full charge of your life, doctor. Don't worry about past. How you read in past, how much you did not, did you have motivation or not? Doesn't matter. Today, you started with Murali Bharadwaj as your classmate. Next 40 days may 40 full-scale grad tests. Every day around 20 topics, 40 into 20, 800 topics you are able to do revision. For example, today you think, okay, let me finish Porphyria. I did mistake in galactosemia. Let me finish pentose phosphate pathway because I did wrong in today's mock test. Similarly, I did wrong today in diabetic ketoacidosis. Let me do the revision. Today I did a wrong in multiple sclerosis. Let me do a revision. Like the 20 topics pakado. Magar test to solve karo. Subah test to solve karo. Very important, doctor. Right? Good to see Pavan Kumar, Meena, Varun, and many more who all joined this discussion. We will once more catch up tomorrow at evening 6 p.m. Good night.